Okay. Good.
All right. Hi, Alexis. I'm going to do your physical exam now. So I'm going to wash my hands. All right, and I'm going to get started. I'm going to start by looking at your head and scalp. And I'm looking at your scalp and making sure it's intact. And then I'm looking at your hair and making sure the texture is good and you're not brittle. Looks good. All right. And then while I'm looking at your face, I'm just going to look and make sure your face is symmetrical, which it is. And then I'm going to check for cranial nerve 7. So I'm going to have you raise your eyebrows and blow up your cheeks and then perch your lips and then just show your teeth. Good. And then I'm going to check for cranial nerve 5, and if you can just grit your teeth. Good. Looks good. All right. And then I'm going to look at your eyes. I'm going to look at your sclera. They're nice and white. And then I'm going to look at your conjunctiva. And they're pink and moist. Very good. All right. And then I'm going to check for cranial nerve 3, 4, and 6. And I'm going to be shining a light into your eye and then have you follow the pen line around. So I'm going to first start with shining the light in your eye. There you go. And your pupils constrict. Very good. And then I'm going to have you follow the pen light in and out. Good. And then continue to follow the tip of the pen light as I move to one side and the other. Up and down. And then up to one corner, down to the other corner, and then up and down. And that's testing for your 6 fields of gaze. And again, that's cranial nerve 3, 4, and 6 that I just tested. Okay, and then while I'm looking at your face, I'm going to check your frontal sinus, any pain or tenderness, and your maxillary sinus, any pain or tenderness. All right, and then I'm going to check your lymph nodes. I'm going to do your occipital, any pain or tenderness, and I'm going to go around to all your nodes and you're just going to tell me if you have any.
Okay.
And your preocular,
Okay.
your postocular,
No.
Your tonsils, your submandibular, and your submantle. Good? And I'm going to do your anterior chains, your posterior chains, and your supraclavicular, and your infraclavicular. Any pain or tenderness while I do that?
No.
No. All right. And then while I've been doing this, I've been looking at your eyebrows, your eyelashes. Everything looks good. Okay. And then I'm going to feel your nose. Any pain?
No.
And I'm just going to shine a light in. Good. And then I'm going to look at your ears. I'm going to check your, sorry.
It's okay.
I'm going to look at your outside of your ear, your trochlear, tracheus, and the outside of your ear. And then do the same on the other side, your tragus, and the outside of your ear. Good. And then I'm going to shine a light in. Good. Good. All right. Looks good. And then I'm going to have you open your mouth, and I'm going to look at your teeth and your gums, and your mucosa, and your tonsils. So if you can open up and say ah, and then you can look at your ovea. There you go, good. And then if you could stick your tongue out for me and move it from side to side. Good. And then press your tongue against my hand, against your cheek. Good. And that's checking for cranial nerve 8, making sure that you have strength in your tongue. Good. All right, now I'm going to go down to your shoulders. I'm looking and making sure your shoulders are symmetrical. I'm going to palpate if there's any pain. Let me know. All right, and then if you can press up against my hands, I'm checking for shoulder strength. And then if you could do a shoulder shrug. And that's checking for cranial nerve 11. Good. All right. Now I'm looking at your chest. I'm looking, it looks symmetrical. You don't have any increased work of breathing. It looks very comfortable as you breathe. And then I'm going to go around to your back. Do you have enough room? All right. And then I'm going to look at your back. I'm going to feel your spine. That's good. And I'm also looking at the back of your chest, or back of your chest, and making sure it's symmetrical. And then I'm going to check for CVA tenderness Any tenderness as I do that?
Mm-mm.
All right. And now I'm gonna listen to the back of your chest, and as I place the diaphragm against you, if you could just breathe in and out. All right. And again. And again. Good. I'm also going to check your sides. Other side. Good. And I'm clear and I hear air movement, so it's good. Any dizziness or? All right. And I'm going to come around to the front. I'm going to do the same thing. I'm going to look at your chest, look symmetrical, and then I'm going to do the same thing. You can breathe in and out as I go along. Alright, and all lymph fields are clear. And then while I'm up here, I'm going to check your carotid. Sorry, my hands are cold. And I'm listening to see if I can feel any thrills. Or feeling if I can feel any. Alright, and then I'm going to listen with my bell. Sounds good. Alright, and then I'm going to be checking your heart. So I'm going to first by palpating. So I'm going to palpate your aorta, your aortic valve, which is the second intercostal on the right side, and then your pulmonic, which is left side, second intercostal space, and then your aorus, which is your third intercostal space in the middle, and then your tricuspid, which is the fourth intercostal space on the left side, and then your mitral, which is your fifth. And then I'm also feeling for PMI. Now I'm going to listen with the diaphragm at all three of those. So your aortic, and S2 is louder than S1, and your pulmonic, your S2 is louder than your S1, your herbs, and they're equal, your tricuspid, and S1 is louder than S2, and your mitral, and S1 is louder than your S2. Alright, and I'm going to do the same thing with the bell. Your aortic, and your pulmonic, and herbs, your tricuspid, and your mitral. Good. All sounds are, I don't hear any murmur, and all sounds are within normal limits. Okay. And then one here, I'm going to look at, sorry, my hands are cold. I'm going to inspect your upper extremities. So I'm looking at your shoulders and your arms, and they all look symmetrical. I'm feeling for temperature, feels good. And then I'm looking at your fingers. I'm checking capillary refill, which is less than 3 seconds on both fingers. Good. And I'm looking for any clubbing or any edema in your hands. That looks good. And then I'm going to feel for your joints in your hands. Any pain when I do this?
No.
And in your wrists?
No.
Any pain? And your elbow? And your shoulder. Any pain while I do that? Alright, and then I'm going to have you do some range of motion. If you can wiggle your fingers and move your wrists, and then flex your elbows, and then rotate your shoulders. Good. And then I'm going to test your strength. If you could squeeze my fingers. Good. And then push against me. Sorry. And then with your elbows, push against me. Good. And then do shoulder shrug again. Against me. Good. All right, I'm gonna have you lay down. So I'm going to inspect your abdomen. First gonna look at it. It looks symmetrical. And then I'm going to auscultate your 4 quadrants. So I'm going to do your right upper. I hear good bowel sounds. And your right lower. Good bowel sounds. And your left upper. Good bowel sounds. And your left lower. Good. And I'm also going to look for your abdominal carotid, or abdominal aortic. Alright, good. Now I'm going to do, I'm going to palpate lightly and then deeply. And so let me know if you have any pain while I do this. Sorry. Any pain besides cold? And then deep. Any pain? And then while I would be here, I would check for your inguinal lymph nodes and your femoral pulse. Put your shirt back down. And then I'm going to look at your legs. And they look symmetrical. You can scoot back if you would like. There we go. So your legs are symmetrical. I'm feeling the temperature of your legs. They look good. And then I'm going to do your capillary refill on your feet as well. They look good. Less than 3 seconds. Sorry. And no edema. Any pain?
No.
No. Alright, and then I'm feeling for your joints and your toes. Any pain?
No.
And then your ankles? And then your knees? A little?
Little.
And I see you have an abrasions on your knees. What happened?
I fell running yesterday.
Alright. Okay, and then I'm going to do some range of motion with your toes. If you can just move your toes. And then move your ankles around. And then if you could bend your knees. Okay. And then I'm going to do your hips. Okay. There we go. There we go. And then if you can push against. There you go. And the other side. And then push against my hands with your knees. Go. And then you can sit up and then press against. Good. Alright. And if you can have a seat back down here. Okay. Alright, so now I'm going to go back to some neuro testing. I'm going to check for a sharp pain and a dull pain. So this is going to be the sharp pain, and this is going to be the dull.
Okay.
So if you can close your eyes and then just tell me what you feel.
Okay. Sharp. Sharp. Dull. Dull.
Oh, sorry.
It's okay.
Sorry.
It's
Oh,
okay.
sorry.
Sharp. Dull. Dull.
Good. I'm sorry.
It's okay.
Okay, and then I'm going to have you flap your hands inside and out. Okay, and then I'm going to have you touch your nose to my finger, back and forth multiple times. Alright, good job. Okay, and then while you're sitting, if you can move your heel down to your shin. And on the other side. Good. I'm going to check your reflexes. I'm going to do your bicep. Okay. I'm just going to look for some reflex. Okay. And then let me know if this hurts because of your knee.
Oh, me.
Oh yeah, sorry. It's okay. Have your legs hang down. And I'm going to do your tiller. There we go. Good. And while I'm down here, I'm going to feel for your dorsal pedis pulses on top of your feet. And then your tibialis on the side. And they're both equal. Good. Okay, and then I'm going to have you stand up. And I'm going to have you walk down heel to toe, and then backwards heel to toe. Good. And then back. Alright, good. And then I'm going to check for Romberg. I'm going to have you close your eyes and stand here for 30 seconds, and then my hands here in case you get lightheaded. So I would do this for 30 seconds. Alright, good. Any dizziness, lightheadedness, any loss of balance?
No.
Alright, and then I'm going to have you check for scoliosis, so if you could bend down, touch your toes, and I'm checking for your spine, making sure it's straight and not curved, and it's straight. Good. And come back up. And I'm going to check for your back range of motion, so if you can bend backwards and forward. Good. And then twist. Good. Alright, so I'm just going to check my notes and make sure I didn't miss anything. Oh, okay. And then I'm just going to check your neck strength. One last thing. So if you could put your head right to left, good. And then I'm going to press against my hand for your neck strength. Good. Good. All right. Well, that completes your physical exam.
Thank you.
Thank you, Alexis.